Good day. Welcome to my YouTube University I channel. We will discuss health crisis. Lessons from eye health and pandemic preparedness by Dr. Jean. Table of content. Case study. COVID-19 and disruption of non-emergency medical services. Optometry Clinic. www.aoa.org. To address emerging children's vision. Page 1. Second, risk identification, how private health practices build resilience, financial, operational, patient safety, which will be found at www.aoa.org, ihealth.covid, page 2. Application to public administration, how lesson from micro-level clinic resilience skill up to macro-level health crisis governance by Virginia Bodolica et al., page 5, references. COVID effect. According to World Health Organization, the effect of COVID to the country, whole world was unemployment, businesses was shut down, lessen monetary transaction, that leads to global economic crisis. Estimated total of 3 trillion in year 2020, 3.2 trillion 2021, it because of lockdown execution. Philippines experienced health crisis because of COVID. The government response was Universal Health Care Act, which aimed to provide monetary protection, accessible healthcare services. Case study: COVID-19 and disruption of non-emergency medical services, Optometry Clinic. Researchers from www.aoa.org to address emerging children's vision. First, collaborate with different professionals, healthcare practitioners, namely educators, nurses, and doctors, because it's the first time the whole world experienced COVID virus. They don't know what to do. They have to undergo this research to know more about this COVID virus. Communication with family for the purpose of safety, care, concern, fear that bothersome to the patient. Information dissemination by using the social media, TV, Zoom, with official, public official, policymaker, and the urgent need of eye checkup. Flexible clinic, operational clinic hours. Risk identification, how patient clinic practice built resilience, financial, operational, patient safety. Reminders in eye checkup. Ask the optometrist about precaution, health protocol to lessen the spread of COVID virus. Second is always wash your hands, especially before and after touching the sensitive part, namely smell, vision, and lips, by appointment in eye checkup to avoid crowding and waiting in clinic. Frequent hand washing is encouraged, especially after using comfort room, sneezing and blowing of nose. Highly encourage the use of face masks, especially entering the eye care clinic. Practice social distancing, 6 feet distance, proper ventilation. Having alcohol or sanitizer is a must as needed. Visit your doctor of manifest signs and symptoms of COVID-19. Be aware if patient is infected with COVID virus. Application to public administration, how lessen micro-level clinic resilience to scale up macro-level health crisis governance. According to Bodolica et al., hierarchy governance defines macro-level policy, collaboration from top management to determine the action, budget, execution, and performance. Hierarchy governance structure help to elevate the performance of the healthcare clinic. Tension in micro and macro integration, healthcare support for the healthcare program, medical doctors collaboration with pharmaceutical for financial incentives, psychological approach of the patient, emotion, preference, mindset, collaboration approach with different healthcare discipline, medical information and assessment needed, patient choice. Conclusion, macro level and micro will serve as a pattern in health assessment. Micro level defines interaction of doctors, patient, and patient rapport, participation of patient in decision of healthcare administrator, the duty of the patient in participation in policy making, healthcare governance, balancing the medical doctors and patient choice. By Bodalica, Veronica et al. The structural framework bridging the macro-micro divide healthcare. This is the hierarchic governance. This is comprises the decision of the top management, that comprises the budget, execution, determining the action, planning stage, economies, efficiency, macro level, which comprises the government, medical, healthcare policy that needed to be executed, the macro level, the daily practice, the doctor, patient interaction, patient's autonomy, the patient choice, the ethics, the governance, and the quality. For this structuralism, the opportunity to achieve the macro and micro governance interaction, reason for macro and micro problem, macro-micro healthcare governance integration through strong structural theories. Philippine setting. PhilHealth to cover eyeglass packages by 2025. Last 2024, when I attended the convention, we are requested to register in this PhilHealth so that the clinic will be accredited. Once the clinic is accredited, what will happen? The patient can visit the PhilHealth optometry clinic for their eyeglass packages. That's part of the PhilHealth benefit. So which means patient can visit the PhilHealth accredited optical clinic for their eyeglass packages. This is PhilHealth to cover the eyeglass packages by 2025, philstar.com. References: American Optometric Association, March 2021, to address emerging children's vision crisis due to COVID-19. AOA Summit puts optometry in lead. Focus on optometry. The future of optometry is now www.aoa.org. American Optometric Association, Eye Health Patient Safety Tips, www.aoa.org. Eye Health COVIDs. Bodolica, Virginia et al. 2015, Structural Framework Bridging the Macro-Micro Divide Healthcare Governance, International Journal of Public Participation in Healthcare, Health Policy, PMCID, PMC 5152727, PMID 26072929, DOI 10.1111, X12375, HTTPS pmc.ncbi.nlm.nih.gov, articles PMC 5152727/ Porcala de Leon, 2024, PhilHealth to cover eyeglass crutches walker wheelchair in 2025, PhilStar. World Bank 2022, the economic impact of COVID-19 crisis, www.worldbank.org, Chapter 1 of Economic Impact of COVID-19 Crisis. Thank you for watching. God bless. That in all things, God may be glorified. Praise the Lord Jesus Christ, to God be glory. Give thanks for His love endure forever. Please don't forget to like, subscribe to my YouTube University Eye channel so that you have latest update. Thank you. May God bless my viewers. May God bless my subscriber. May God bless the work of your hands. Thank you. Thank you for listening. God bless.